In your opinion, what do you think the most beautiful bone in the human body? Think. Okay, gentlemen aside, let me talk to ladies. Ladies, what do you like to wear off shoulders? Look, look what hot bone can do. Look how elegant and beautiful that bone is. And of course, that's the clavicle. What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Kenny. And today, let's talk about proclaimed the most beautiful bone in the human body. Clavicle is the topic of discussion today, and the word clavicle comes from Latin word clavis, which means a key, and so clavicle means a little key because it resembles a key. But most importantly, the movement of the clavicle, of the clavicle, rotation of the clavicle along its long axis resembles the rotation of the key as you are unlocking your door. So as you are unlocking your door, that's the same way on how the clavicle moves. So it gives the name from its resemblance to the key. Okay, so the clavicle is also known as the collarbone because here is where the collar of your shirt passes by. But actually, the clavicle is the one that holds the backpack. When you are, wearing a backpack, the strap of the backpack will be held against the clavicle. So the clavicle is actually the one that holds the straps of the backpack, and so the heavy of the backpack. And so when you have like wearing a very heavy backpack and then you feel like your shoulders are tired, actually what experiences the stress is the clavicle, the so-called the collarbone. So it lies horizontally and it connects it lies horizontally and just above the first rib, and it connects between the sternum and acromion process of the scapula. As I've told you, this is considered the most beautiful bone in the human body, but the reason is yours to find out. So you have an homework today and go and find out why is the clavicle considered the most beautiful bone in the human body. But probably it's because it's subcutaneous throughout its length and it's more visible than any other bone, so maybe it could account for its for this feature. Another strange thing about the clavicle. So the clavicle is actually smoother and straighter in females, and it is more rough and more curved in males. So that's another difference between the two gender. So the clavicle, as I've told you, it connects the axoskeleton. It connects the scapula and the scapula and the sternum. So it has got two ends. It has an end which is connecting to the sternum, to the manubrium part of the sternum. So this is known as the sternal end, and this is known as the lateral end of the acromial end. So it actually connects the axoskeleton and the appendicular skeleton, axoskeleton and appendicular skeleton. So let's talk about how important the clavicle is. So the clavicle actually, it protects it is here protecting the neurovascular structures, not to mention the subclavian vein, the subclavian artery, the brachial plexus, and if that's not enough, the apex of the lung. They are all protected by the clavicle. So I'm sure these structures mean nothing to you at this time, but as we're moving on, we will discuss the structures sometimes later, and then you will understand how important the clavicle is. As I've told you, the sternum has got two ends. The clavicle has got two ends. It has got the end that is toward the sternum, and this end will articulate with manubrium of the sternum to form the sternoclavicular joint, a joint between sternum and the clavicle. And what is most important about the sternal end is it is rounded. It is rounded. Okay, the lateral end is also known as acromial end because this acromial end will articulate with acromion process of the scapula to form the acromioclavicular joint. And again, what is so important about the acromial end is that it is flat and broad. flat and a broad. The acromial end of the scapula. But of the clavicle. But the clavicle can also be divided into three parts. The lateral, or three parts, or the three thirds. So we have the lateral third, the middle third, and the medial third. Remember to differentiate between the middle and the medial third and not confuse between the two. But why are this important? Because these form the basis of descriptions of the different fractures of the clavicle. So the clavicular fractures are described in terms of these thirds. And I will tell you that most of the clavicular fractures will occur at the middle third of the clavicle. Most of the clavicular fracture will occur at the middle third of the clavicle. Middle third of the clavicle. I tell you why. But it's more. Also, I tell you later today that it is more likely to occur. Not at the middle, like the middle part, but towards the lateral third, towards the lateral third. Okay, so this was the superior view of the clavicle, and we've seen these features. Okay, so let's see how important the clavicle is in terms of biomechanics. We have already seen how important it is in terms of protection of those neurovascular structures and the apex of the lung. But in terms of the movement of movement and all that, let's see how important clavicle is. So the clavicle actually, the function of the clavicle actually is to keep the shoulder joint away from the thoracic cage, from the trunk. It keeps the shoulder joint away from the trunk. So it's like it tells the shoulder joint, bro, where do you think you're going? You're not supposed to be anywhere near here. So go away. And the clavicle is not trying to be selfish here. It's actually for the sake of the movement of the shoulder joint. Remember, guys, the shoulder joint is the most mobile joint in the human body. The most mobile joint in the human body. It has a wide range of motion than any other joint in the human body. But this mobility, this degree of mobility, is partly attributed by its lateral placement. The shoulder joint is this mobile because it is somewhere away from the trunk, So for it to have this flexion, extension, circumflexion, and all other abduction, adduction, it is important for this joint to be away from the trunk. So, and it's kept away from the trunk by the way of the clavicle. Assume if we didn't have clavicle, so the shoulder joint will be collapsing against the wall of the thoracic cage, and then you will find that your shoulder is somewhere around here. So the movement of the shoulder joint would be significantly impaired if we didn't have the clavicle. If we didn't have the clavicle, the movement of the shoulder joint would be significantly impaired. But so the clavicle is not trying to be selfish here, to keep the shoulder joint away from the trunk, and for that reason, the clavicle is it forms an anterior strut to keep the shoulder joint away from the trunk. But the clavicle goes the extra mile to help the arm. See how polite the clavicle is. Just apart from just keeping it away to maintain its highest degree of mobility, the clavicle is also telling the arm that, okay, bro, in case you're experiencing much stress, don't forget to call for help. I'm always here to help you to get your back. So the clavicle also helps to dissipate and absorb mechanical stress from the arm. For example, when you are pushing something maybe heavy, your arms will never act alone. In fact, they will need assistance from the trunk, and the trunk is being connected to the arm by the way of the clavicle. So actually, the clavicle will absorb the mechanical stress that is coming from the arms. It will absorb it, dissipate, and then it transmit the remaining stress to the trunk to make sure that the trunk is experiencing minimal stress. Okay, so it absorb the stress, it dissipate, reduce the strength, and then the remaining low forces or low energy will be transmitted to the trunk. So for that way, the clavicle is also acting as the shock absorber. It also acts as the shock absorber. But it turns out, like, after doing all this, after being this helpful, it turns out that the clavicle is one of the most fractured bone in the human body. One of, if not the most common fractured bones in the human body. This is how it is, rewarded after doing all that. This is how it is rewarded. So let's talk about the curvatures of the clavicle. So clavicle is very special because it's double curved bone. It has got two curvatures. It has double curvatures. So it has a shape of it's a sigmoid. It's a sigmoid shape bone. It's like the stretched letter S. Okay. So the clavicle is very special because it has it is double curved. It has double curvatures. So it has the medial part. Combining the middle third and the medial third to get the medial two third. So the medial two third of the clavicle is convex anteriorly. When you are viewing from anatomical position, the medial two third of the clavicle is convex anteriorly. The medial two third of the clavicle is convex anteriorly. Okay, and the lateral third is actually concave anteriorly. The lateral third is concave anteriorly. Guys, remember the convex is the convex and this is the concave. And if you're using a cycle, the outer surface of the cycle represents the convex strut, it's convex surface, but the inner side of the cycle represents the concave surface. So the lateral end is concave anteriorly. Okay, so why is the clavicle not a straight bone? Why is it not a straight bone? Remember, the function of the clavicle is to absorb, dissipate the energy and transmit the remaining mechanical stress to the trunk. Okay, and curved bones, they do this shock absorbing stuff very efficiently as compared to the straight bone. The straight bone will actually directly transmit the energy without dissipating the energy, without reducing the strength of the energy. And so the curvatures, these curvatures, they act as springs. They act as springs. You remember, even the springs of the vehicles, they are a little bit curved. So they are a little bit curved. So the curvatures, they act as a spring to dissipate and absorb the energy, to make sure that the trunk or the sternum is experiencing a minimal mechanical stress. All right, so it happens. Okay. So it happens that most of the fractures will occur, as I've told you. Most of the fractures will occur on the middle third of the clavicle, but as I've told you, is towards the lateral third. So actually, it is at the junction between the lateral third and the medial two third where the clavicle fractures the most, and this could be attributed by a number of factors. Number one, at this point is very thin. It is very thin and the weakest point of the clavicle. And actually, this is where we have a transition from, you see here, this is like a tubular bone. So we have a transition from a tubular bone, little bit circular, to more flat and a broad bone. So we have a junction somewhere here, and this junction is a weak point of the clavicle. Again, the extremes of the clavicles are covered, enhanced by or enforced by different ligaments and muscles. So because this is also forming a joint here, acromioclavicular joint. This is sternoclavicular joint. So they also reinforced by a number of ligaments, but also by the muscles. But this region here is a little bit bare, so it is bare region, and it is prone to fracture. So most of fracture will occur at that junction between the medial two third and the middle third, but that region belongs to the middle third of the middle third of the clavicle. You cannot forget about that. But the fracture at this point is actually protective. So fracture at this point is actually protective. Someone is like, what are you talking about, bro? Why? How is the fracture a protective mechanism? I'm gonna give you two scenarios, and then I'm gonna give you two scenarios, and I leave it for you to to decide whether or not whether it is protective or destructive process or mechanism. Okay, so yeah, number one, assume in the first scenario that the clavicle is experiencing high or too much mechanical stress, more than it could accommodate. Too much mechanical stress, more than it could dissipate and absorb. So number one, the number one scenario, the clavicle is trying to be a hero here. It's trying to be brave, the brave guy. So it acts alone. Okay, so I'm gonna handle this stress. Okay, so it transmit all the energy, transmit all the mechanical stress to the sternum. And then what happens if it does so? If it does so, the sternum will experience much mechanical stress, and so it is more likely we're going to have a fracture of either the sternum or the distal third of the humera, the medial end, the sternal end of the clavicle, or the first rib. And what if any of this happens? If the, for example, the lateral, the medial end of the clavicle fractures, it's gonna lacellate the subclavian artery. Remember, we also have subclavian vein somewhere here, so they are prone to injury. But don't forget about the brachial plexus. But if that is not enough, if that is not dangerous enough, we have an apex of the lung somewhere around here. So if we have the fracture of the medial end of the clavicle, it's actually more dangerous because of the structures that are underneath here, because of the the vessels, the neurovascular structures, as well as the apex of the lung. So it is more dangerous if it fractures in this part. That was number one. Scenario. But the second scenario, in the second scenario, the clavicle is experiencing too much mechanical stress, more than it could accommodate. So for the sake of these structures, this clavicle is wise enough to break at this bone, at this portion here, to break at this portion, because it understands if it's going to break on the medial end, it's going to traumatize the structures, and so it could endanger the life of the person. Okay, so a wise clavicle is always more likely to fracture at this point if it has to, because remember, the clavicle is trying to be brave. It's trying to handle the mechanical stress that's coming from the upper limbs, or maybe from a direct hit, because we have two mechanisms there. We can have the direct hit, like a direct blow to the clavicle, but we can also have the energy, the mechanical stress transmitted from the upper limb, So in this case, the clavicle is trying to be brave, but it remembers, but the mechanical stress is too much to handle, so it chooses to break at this part here for the sake of these structures underneath. Does it make any sense to you? Yeah, so that's a protective mechanism to protect the structures, those structures above. So let's now talk about let's now flip the clavicle inferiorly and see what we have on the inferior view. Let's see what we have on the inferior view. So as we have said, we have the lateral end, which is a acromial end, and of course the sternal end, but because of this acromial end, it will articulate with the acromial process of the scapula. So we have the acromial facet over here. And we have also trapezoid right in here, where the trapezoid ligament come to attach. We also have a conoid, which is coney-like tubercle. The coney-like tubercle, where the conoid ligament will also come to attach. We have a groove here, and this groove is known as the subclavian groove. Is where the subclavian muscle will passes by and attach. So and then lastly, we have an impression here for the costal clavicular ligament. So we have a ligament between the costal, which means the lip, and the clavicle ligament, which is the clavicular ligament. Again and again, I told you the other time we were discussing the the humerus and the scapula, that at some point in the exam you'll be asked to tell you if this is the left or right clavicle. So we'll be asking your exam to tell if this is the left or right clavicle. And some students will also confuse the clavicle and the ribs. Okay, we talk about the ribs sometimes later, but you can never ever confuse between the clavicle and the ribs. So your examiner is asking you, is this the right or the left clavicle? So what are the features that you're gonna consider? Number one, you're gonna talk about the ends, and if that is not enough, you talk about the curvatures, the curvature. So number one, you will always remember that the rounded end is the sternal end, and it always points medial. So the rounded end will always point medial when you're putting in anatomical position. The lateral end is flat. The acromial end is flat and broad and always points laterally. But if that is not enough, because we have superior and inferior view, but if that is not enough, talk about the curvatures. Remember, the medial 2/3 of the clavicle is convex anterior. The medial 2/3 of the clavicle is convex anteriorly, and the lateral third is concave anteriorly, when the clavicle is put in anatomical position. So putting all these features together, you will be able to tell whether this is the right or left clavicle. I mean, you put in anatomical position, the medial 2/3 is curved anteriorly. It's convex anteriorly. The lateral third is concave anteriorly, and then the sternal end is pointing medially, and the heel. So this is definitely the right clavicle. So guys, do you I guess you already know that the clavicle is the most beautiful bone in the human body, and the reason is viewers to find out, and that we already know. But do you know that the clavicle is the only bone in the human body that lies horizontally? So it's the only long bone in the human body that lies horizontally. But it is also the first bone to ossify in the uterus. I mean, when the baby is still in the uterus, the very first bone to undergo ossification, to begin ossification, is the clavicle. The clavicle is the first bone to undergo ossification in embryologic development. If that is not enough, the clavicle is the only bony link between the axial and appendicular skeleton. Is the only the osseous link, the bony link between the axial and appendicular skeleton, but the above, the upper extremity, not the hip, not about the hip. Okay, so that's the only. Wait, someone will say, what about scapula? Just told us the scapula is connecting to the axial skeleton. But remember, scapula does not make direct contact with the trunk. It's actually connected to the axial skeleton by ways of muscles, and then we've seen the posterior axoappendicular muscles, and that are the one that connect. But the osseous link of the upper limb is only provided by the clavicle. So guys, I think you have enjoyed the discussion of the clavicle. You can always write me an email, but don't forget to like, comment and share this video with your friends. And you can always find me on TikTok and Instagram.